The year began with the National Association of Nigerian Nurses and Midwives going on a warning strike. The nurses claimed they were feeling overworked after calls to recruit new nurses went unheeded, and after several of their colleagues traveled to take up jobs in other countries. The strike was short-lived in Lagos. Government came to the negotiating table, promising to get more hands. The phenomenon of brain drain did not abate among them and other professionals in the sector. Between 2016 and 2018, 9,000 doctors left Nigeria's shores, but the number increased in 2022.
Brain drain will always happen because people are always wanting to go outside to maybe get a better education or a better postgraduate, or salary is better or whatever. But what we're doing is we have another strategic approach, which is what we call brain gain strategy. We're building a psychiatric hospital, 500-bed psychiatric hospital, and then a 1,000-bed rehabilitation center. We are developing an infectious disease research institute. Now, when you set that up, all these specialties within the system, then our colleagues abroad, doctors, nurses, are saying, hey, there's something to come back home for.
Given the declining number of cases across the country, COVID-19 restrictions were lifted by degrees, culminating in the suspension in December of PCR test requirements for all pre-departures and post-arrivals. Ironically, cases are currently spiking in China, where the pandemic began. Monkeypox had been popping up since 2017 in its most recent reappearance in Nigeria, but in a twist became a hot topic when it was reportedly transported to the UK in early May of 2022 by someone who traveled from Nigeria, and for the first time the disease spread rapidly among non-endemic countries. Other infectious diseases, including Lassa fever and cholera, were also concerns in 2022, claiming more lives than they did in the previous year.
There were disruptions to immunization, both routine and planned campaigns. The world tried to recover, to sort of say, look, essential services should return, but we know that the journey to doing that has been really hard. And now what we are seeing is we are now paying the price for the gaps that occurred there.
It was a moment of pride for Nigeria when the World Health Organization awarded the National Agency for Food and Drug Administration and Control, NAFDAC, Maturity Level 3, a certificate which grants Nigeria the capacity to use mRNA technology to manufacture vaccines, among other medical preparations. Private sector initiatives in Parkinson's disease, cancer, and sickle cell anemia were also undertaken to provide much-needed diversity and availability to often neglected conditions.
With this transplant center in place in Lagos, not only will Nigerians cease to travel out to access a cure for sickle cell disease, but it will in fact be a new dawn for medical tourism into Nigeria.
In July 2022, newly appointed Minister of State for Health, Honorable Ekumankama Joseph Nkama, took over the mantle of leadership from his predecessor, Dr. Olorunimbe Mamura, who went on to become the Minister of Science and Technology. Nigerian doctors have been making their mark on the world stage, and for the first time an African, Dr. Osahon Enabulele of Nigeria, became president of the World Medical Association. The 1.179 trillion naira allocated to health in the proposed 2023 national budget may seem like a big jump from 826.9 billion awarded last year, but is a mere 5.75% of the budget. The ideal of 15% of the nation's budget being allocated to health has not been achieved yet, leaving the sector in want of funds to improve on infrastructure and research, among others. For the sector to transit from reacting to being ready for every health emergency, more must be done in research, infrastructure, recruiting manpower, and capacity building. Mary Alale Yusuf, Channels Television News.